But I think one precaution which I would like to recommend to every person who wants to practice on the cadaver.
Why is it important for an orthopedic, both budding and a practicing orthopedic surgeon?
Or when you are operating on a cadaveric limb, you get exactly the same type of a feeling as if the tourniquet has been put on. This is the best model, not only to learn a surgical exercise, but also to have a real life-like feel.
Hello students, I am Dr. Harpreet Singh and I represent Team Conceptual Orthopedics. Today with us in this podcast we have Professor Dr. Anil Dahl sir, the esteemed faculty of Conceptual Orthopedics and former Head of Department of Orthopedics, Maulana Azad Medical College. Welcome to this podcast, sir.
Thank you, Harpreet.
Sir, talking about cadaveric exercises as a training option or as a training tool for budding and practicing orthopedic surgeon, there has been recent surge in them, and you must have conducted various such exercises during your professional career, and you did one with us some time back. So what is your view? What was your experience in that, and why is it important for a orthopedic, both budding and a practicing orthopedic surgeon as a training tool for them?
I think, Dr. Harpreet, you have raised a very pertinent and important issue regarding training of the orthopedic surgeons. You must have gone through the same training program that I went through, or all the doctors go through, that when they join the medical profession in the first year, they are placed amongst the dead.
Yes, sir.
And they learn about the anatomy. So there is no substitute to the cadaver model in learning anatomical principles, anatomical distribution of various muscles, ligaments, nerves, blood vessels, and so on. And we all know that surgery, including orthopedic surgery, is heavily dependent on the knowledge of anatomy. Along with that, the practice of surgical skill, the actual experience of how the tissue feels when the scalpel is cutting the tissue, and what is the distribution or disposition of a particular structure in relationship to the other anatomical structures, can only be derived if you have the cadaveric model. I think in all the simulation tools that are available today, the cadaveric model probably is the best because it is more akin, it is the nearest to the actual lifetime experience which you get when you are operating on a patient. Being operating on a limb, we by and large use a tourniquet.
Yes.
And when you are operating on a cadaveric model, or when you are operating on a cadaveric limb, you get exactly the same type of a feeling as if the tourniquet has been put on. So, in my opinion, this is the best model, not only to learn a surgical exercise, but also to have a real life-like feel of what the surgeon is going to encounter when later on he is operating on a live patient. So this is, I recommend this to every budding orthopedic surgeon and also practicing orthopedic surgeons. The only constraint is that we do not have many of these fresh cadaveric labs. You see, in the anatomical dissection hall, we were used to formalin preserved
sir.
cadavers,
Cadavers.
which do not give you the real-time experience. But for a surgeon, it is the fresh cadaver which is important to practice a particular surgical exercise or to practice an approach which he is not tuned to, and that can only be done on a fresh, frozen cadaver.
So availability of those fresh cadavers is
Yes,
not that easy.
I think slowly we are getting into that mode. We have some of these cadaver labs operational in down south, and I'm sure sooner we would have something in North India also, and we will request the Conceptual Orthopedics team to
Yeah,
make some effort in that direction.
Yeah, we succeeded in doing one a few days back, and
Yeah.
we are hoping that we can get some more time on such cadavers so that we can do more exercises like that. And watching those things, the recordings of those things would also be helpful for the students also.
I think this is another very important area which needs to be highlighted. When you are trying to document, you're trying to photograph, you're trying to have a video recorded while live surgery is going on, it may delay the surgical time. It may prolong the surgical time, which can in some way harm the patient. But if you are recording on a cadaver, on a fresh frozen cadaver, it is akin to operating on a live patient. At the same time,
Without any
you can take as much time as you want to record. If the recording is not good, you can revisit the cadaver, maybe on the contralateral limb, do the same procedure again. There's so many advantages of operating on a cadaver. But I think one precaution which I would like to recommend to every person who wants to practice on the cadaver model, all HIV precautions should be taken when you are practicing on a cadaver.
all the universal precautions
Universal
we take
precautions must be
in, as in while operating on a patient.
Yes.
Same have to be.
Yes.
Yes. So thank you, sir. Thank you for sharing your views with us, and we'll hope to have you soon again in some other podcast.
Thank you, Harpreet. It's a pleasure always talking to you.
Thank you, sir.
Bye.